a bit in the news lately, so I want to clarify this as well. The Centers for Disease Control and Prevention, which is essentially our leader nationally for public health and all public health recommendations, have done studies that have looked at the potential for lead to be absorbed through skin, or whether it could be absorbed through skin. Based on the way that lead is absorbed into the body and causes its metabolic or chemical effects upon the body, it is safe for parents to continue normal bathing habits for themselves and for their children. Now, that caveat is this, that the bath time be used for bath time only. So rather than having the child sit in the bath and play for an hour or more at a time where there's an increased chance that they may get hand-to-mouth activity or water splashing into their mouths and such, we hardly recommend use the bath for bathing, remove the child, dry the child off for the usual, but no extended time. There is nothing there in the water at this point that we're aware of that has any effect per lead or any of the phosphate levels. The phosphate levels also look just fine, and we're not aware of any other corrosives or contaminants. Parents can help also their children if there's been any effects on children with exposure. I want to make another caveat here. If I get a blood lead level test on a child right now, today, if I draw their test and it is 0, that does not mean that they weren't exposed in the last 18 months or since April of 2014. The blood lead tends to disappear from the body after exposure within about 28 days. So then you might ask us, well, why are we testing the children then? Well, first, we know that water is still not safe. So there's a potential if we do a case investigation and that home does not have an adequately placed filter or a filter at all, we can identify that child that may be exposed to ongoing unfiltered water. The other is that we can identify the whole cohort of children that have currently elevated blood lead levels so they can get the adequate case management that Director Lyon mentioned. But it is important that when we think about a public health perspective, that we consider the whole cohort, we call it a group of people, exposed to the drinking water, especially 6 years and under, since April 2014, as exposed, regardless of what their blood level is on January 11th of 2016. So, again, I want to talk about nutrition. Foods that keep lead from being absorbed into particularly a child's body is foods that have calcium, vitamin C, and iron. I also like to thank our healthcare partners. We have worked together in leading a webinar for physicians and plan to continue our partnership going forward to help ensure that our residents are screened and followed up with as soon as possible. Thank you. Director Cray.
Thanks, Doctor. I'm Keith Cray. I'm the Director of the Department of Environmental Quality. I was asked to make a couple comments. So I started my job January 4th, and my first task was to make sure that the processes and practices within the Department of Environmental Quality actually provided the appropriate outcomes. So my first call was the EPA to Susan Hedman and said there cannot be any daylight between the regulatory agencies. No longer can we talk about corrosion programs and corrosion treatment. The citizens of Flint deserve safe water, irrespective of any other regulatory confine. Our process was not rigorous enough to assure that. We got into a 6-month testing protocol, which was a corrosion program that didn't fit muster. And so what we need to do is make sure that it'll be results-driven and data-driven, and we're committed to do that. So we assigned our Chief Deputy Director, Jim Saigo, to be a division director. George Christian is our laboratory director who has great scientific rigor. He is the Flint contact person, and he'll make sure that your questions are answered, and we'll make sure that we are accurate. And I stress that. We need to be accurate. And so what have we done? Our lab is now 24/7. We can run the samples. Samples will not be a bottleneck. We're fully embraced and engaged in the Emergency Operations Center. We have been out testing schools, so there's 13 facilities in Flint that we've tested 2,500 samples. But all that does is indicate where the problems might be with faucets and fixtures. The good news is we haven't found it further back into the plumbing structures. But we have work to do because we'll have to replace those and then test those and then to assure that there are not unacceptable levels. There's about 700 samples that have been submitted already. 75% of those are under 5 parts per billion. 92% of those are below 15 parts per billion. Well, what does that really mean? We don't know how the samples were taken. We don't know what sample integrity was. We don't know what side of the filter they're on. So actually all that does is that's just a data point in time. So as my colleagues have said, We need to continue to utilize filtered water. We need to establish a baseline. We need to be very aggressive then in retesting, and then we have to make sure that we get it right. We are working hand in glove with the officials and the experts in Flint and the water treatment, as was mentioned. The water coming from the Great Lakes Authority was 0.3 parts per million. That's now being added to, so it's 1 part per million, so we can rebuffer, if you will, those lines. And then that hopefully will reduce the end results. I'm asked the question, when can you assure us that happens, Director? I can't stand here and tell you a date. I can tell you that let's take some samples and let's make sure we're accurate. And let's make sure that we think about the end is the outcome, and the outcome is safe drinking water. So thank you. Governor?
Yeah, I just wanted to come back up to reiterate something, because I don't want anybody walking out with the wrong information or some confusion. And I'm speaking as the mayor, but I'm speaking as a licensed clinical psychologist as well. And we all know that we need to educate people about lead. Lead is a public health issue, and we know that lead comes from dust, and we know that lead comes from paint chips and other sources. But today it is about the lead in the water. I don't want us to get off of that. So I just really need to emphasize that, because I don't want anyone walking out of here saying that we are trying to put it off to other sources. We know it comes from those other sources, and we need to educate people about that and continue to monitor that as well. But today we are here about lead in the water. Thank you.
Thank you.
We take some questions now, and we're going to ask to be called on and quotes from me. I'll make sure we do it in an orderly fashion. We're going to start with Dave Bobby from TV 25.
Governor Snyder, I work for NBC 25 and Fox 66. Some people are calling for your arrest, others calling you a potential murderer. How could you in good conscience not have done greater due diligence? Do you agree that your staff and you are responsible for the illness or deaths that come from this contaminated water?
Well, what I'd say is I've apologized for what's gone on with the state, and I am responsible for state government. So I have a degree of responsibility, and that's why we've tried to be prudent about taking actions to address where those problems were, what those issues were, to ensure they didn't happen, and then be proactive to take steps to address these situations. And again, I wish they never would have happened. So now we're in the mode of saying, let's focus in on how we get safe drinking water in Flint, both short-term and long-term. How do we work closely together to deal with the long-term health consequences?
Question for you. A lot of mistrust here outside that door you can see. What specifically is going to be done in the future to regain that? What kind of transparency are you promising?
Well, again, you're seeing it here today. Again, we're sharing information. We'll have regular reports on data in terms of where we are with water filters, information. The test results, as we talk about water tests, we went through numbers about how many people have had their blood tests, how many water tests have been done, what those results show. We're going to continue on that path of sharing that information. And the other part I'd reiterate, it's not specifically part of this, is we want to build a strong relationship with the mayor. So one of the actions we're also taking is transitioning more authority back to the mayor, and that will be taking place this week. It should be on the agenda for the RTAB board later this week on Wednesday, in terms of giving the mayor more authority to hire and fire her team.
Can you clarify this and maybe put it to rest, just in terms of when the potential problem with lead in Flint's water was brought to your attention and what you did after you found that?
Yeah, the real issue, the most clear event was when the Department of Health and Human Services confirmed the results from Hurley Hospital in terms of elevated blood levels, and that confirmation, I believe, was about October 1. We actually started taking actions on October 2. And again, I held a press conference on October 8, including the reconnection to Detroit, and I need to thank a lot of partners for that, including the Mott Foundation. Yeah.
Chad?
Did Dennis Muchmore inform you of this issue in late July, and did you sign off on the distribution of 1,500 water filters this summer?
Well, two things. Those are two different topics. In terms of Dennis Muchmore, he was an outstanding chief of staff who's just soon to retire, and I appreciated his email. We were concerned about getting feedback from the community, and we wanted to push on departments to say what were they finding, and to be open with you, they came back and reaffirmed they didn't believe there was an issue. That was not the correct outcome, it turns out. in retrospect. That was one of the problems with the situation. But we were very proactive. With respect to the water filters earlier in the year, I was happy to support that because that was not with respect to just lead. That was because of their concerns about odor and other issues, the quality of water in general, and to say we could do more to help people in Flint, we always want to be proactive.
Channel 4?
Yeah, Hank Winchester, Channel 4. Governor, with all due respect, what is taking so long? You say that you learned about the situation in its entirety in October. Today at fire stations, there's no water, there's no filter at many stations. People outside tell us that they feel helpless, they feel stranded, and frankly, they don't believe you anymore. At what point do things change? Why isn't FEMA out here right now with trucks handing out water to people that need it?
Well, again, I think you're going to find the fire stations hopefully do have water and filters. We started ramping up, again, this whole process in terms of providing resources to people. We had been doing that for months, but we need to do more. And so that's the whole process. That was part of the declaration done by the mayor, followed by the county, followed by the state, and we're going through the appropriate protocols to get that done with the federal government.
But it's not working. There's no water right now at the fire station on Atherton Road. There's no filters. So whatever you've been doing is not working.
Well, we're continuing to work hard. It shows there's demand, and we're going to continue to step up our efforts to make sure we take care of that.
Channel 5?
Governor, when we talk to the people of this state and of this city, particularly, they're sick. They're sick of the water and they don't have answers. You give stats of numbers, but the numbers are nearly 1 million people who live in this community, and those numbers are less than 2%. How do you sit here before us and say that that's a good presentation when we need stuff done expeditiously to make sure these people don't get sicker?
This isn't about good or bad presentations. This is about achieving results. And our goal is to get better results for the citizens of Flint in terms of making sure they have access in the short term to filters and bottled water so they can have a safe drinking supply. In longer term, making sure we take the steps, action steps necessary to make sure the traditional water system can work with better support from the EPA, with the DEQ, and all of us working together to make sure there's good, safe water that comes out of that faucet.
Chief Wensky, can you tell us please how the water is getting to the stations and how it's available to people?
Certainly. Our role is to support or supplement, I should say, what's being done at the local level. So at the city level, at the county level, and at the state level. And all of us are working together. We do have warehousing operations going on. We have trucks moving supplies as quickly as possible. And we'll continue to do better, to get more, as the governor said, to ensure that those resources are there for the citizens of Flint.
Danielle Emerson from Dow.
Governor, you mentioned that you're looking at having a discussion with FEMA. How long do you expect that to take before you get federal assistance? Will it come in the form of money, more bottled water? What do you see that?
Well, that's the protocols we're going through now. To give you a benchmark, again, we unfortunately have had disasters in the past in Michigan, and the last two would have been natural disasters, flooding in Grand Rapids and flooding in Detroit. In both those cases, I can't say it'll be the case in this particular one because this is an emergency as opposed to a disaster, but in both cases it took 31 days in one case and 36 in the other. But we're working as promptly as we can. A lot of it is making sure we have quality information, and we're continuing a dialogue with FEMA while all this is going on. So it's not like they're isolated. We just haven't put specific information to them to say, here are the specifics of what's being requested.
Jacob from Mercer.
Thank you, Governor. Two quick things here. With respect to the timeline, going beyond October 1st, can you at least acknowledge some of the state knew there was a problem here before October 1st? Number two, your task force recommended a culture change at the DEQ division that was in charge of this. What does that look like?
Well, we've made leadership changes at the top. We have a new director standing here, and we've made a number of other personnel changes. So that was something that we've already taken place. Again, we're going to continue to look at issues to see if more are required. But we've been very prompt in responding based on what their comments and concerns were.
Our friend behind Danielle, Antonio Emerson. Not you.
Okay, Governor, one thing that, besides the hardships people in Flint are experiencing with the water, one thing I think people outside of Flint don't really understand is that why people in Flint are paying such, one of the highest water bills in the nation. And I'm told they're getting penalties, they decide to cut off, they want to cut off the water. So they're paying for water that's poisoning them. What can be done, and, is that being addressed at all?
Well, again, there's lots of issues with respect to the whole transition of what took place, and that's what we're going through all these issues to say, that's why I created the advisory group in particular, an independent group of people to say, what are the concerns and challenges to making the change? I know the mayor's concerned about it, and I continue to plan to work with the mayor to get feedback and input on how we can collaborate to make water more successful in Flint, but life in general better in Flint.
Governor Snyder, we talked about the short-term fixes, but what about the long-term in terms of helping to fix our infrastructure? Because we know that's a big problem. Any idea on the time frame about that?
That's something we need to continue to work on. Again, that's a statewide issue. If you look at, we spent the last 3 years working on road infrastructure, and at the same time I made it clear that we need to work on our water and sewer infrastructure across the state of Michigan. So that's going to be an ongoing topic that we need to look at, and particularly Flint, because of the immediate crisis, but longer term we need to look at how do we deal with aging infrastructure across Michigan for water and sewer.
On the floor is Steve Carney, Commissioner Radio.
Governor, you've got your State of the State coming up. How much of that is going to be affected by the Flint water crisis, and is this going to prevent you from doing any of the other things you want to do during the remainder of your term?
Well, again, this is something that deserves a lot of attention. This is a crisis, so we're responding appropriately. There's more work to be done, and I'm willing to roll up my sleeves and partner with the mayor and the city of Flint to do what needs to be done to solve this problem. So it's a key focus. At the same time, I will give a State of the State address and talk about some other initiatives. And again, I hope we have a broad enough team where we can work a parallel path on a number of other important topics to the future of Michigan. Much of this ties together. It's much like the question on water and sewer infrastructure, though. This is a real illustration that this is a real problem.
Right next to Chad, sorry.
Alicia Anderson, Detroit Free Press. Do you think it's fair for the residents of Flint to have to pay for their water from April 2014 up until present, given they can't drink their water?
Well, again, I'm not going to speculate on all those kind of questions. There's a whole process for the water department. Again, I'm going to partner with the mayor on seeing what, if anything, should be addressed in terms of the particular situation on billing and such.
Mr. Kirsten.
Governor Jim Kirsten with Channel 7 out of Detroit. I asked you this last week. You said a short time ago you want to take all of the questions. It's been asked a few different ways, but what was your epiphany or your aha moment that this is a crisis and I need to act? Was that before just last week when you declared the emergency? And folding into that, you said your team responded in early October. No offense, but I asked Mr. Lyon over at Kettering University on October the 2nd specifically if he thought this was an emergency as was declared locally. He responded no. So what did you know, and when did you know it, and when did it rise to the level of emergency?
I answered that earlier today. I said basically it's around October 1st with the confirmation of the blood test results. And so at that point, we moved actively to make a transition back to the Great Lakes Water Authority. We took multiple other steps that have included other 12,000 filters being distributed. Again, testing in schools, doing blood tests, raising the level of that, but it's not been enough. And so it needed to go to another level, and that's what we're doing now.
Dave Vonley's got one more.
If you have contaminated water coming from your tap at home, should you have to pay for it?
Again, that's one of the questions that we'll be reviewing. Our focus right now is
The question is, should you be paying for contaminated
the issue.
water if it came out of your tap?
We're addressing the immediate issue now, which is making sure people have water filters and other resources. I'm answering your question.
You're answering someone's question, but not mine.
Chad?
Governor, just to follow up Jim's question, if you thought it was an emergency and needed to switch water sources on October 1st, why did you wait 3 months for an emergency declaration?
Well, again, we were taking actions to distribute water filter, free water. All those steps were taking place back in that date. In terms of the declaration process, that really follows a protocol that says it goes from the city declaring it to the county to the state. Those actions were not taken until the new mayor took office, and I give her credit. That's why I want to really thank her for her efforts to highlight the nature of this issue and that more needed to be done.
There was an emergency declaration.
Mayor Weaver, this is for you. A lot of criticism while you were running for mayor of the governor himself, his administration. I mean, strong words coming from you. What was the turning point? Everyone seems very cozy up here now. I'm just wondering what the turning point was.
Well, I was put in a position where I was able to make the ask, and one thing that had not happened was a declaration had not been put in place. And so I was able to do that. Since I have been meeting with him, things have been moving. Now, I don't know if you want to say it's cozy or not. I don't think those are the words to describe it. But my priority is the citizens of Flint. I can stand up here and fight with him, or I can try to get the people out there what they need. And that's what I was elected to do, is to put them first. We want people to be held accountable. There's a process in place for that. So I need to focus my effort and my energy on making sure we have going forward what we need to have. So I'm working with people.
The doctor says it's safe for children to bathe in this water, Governor. Would you let your children right now bathe in this water?
I would follow the advice from our chief medical officer.
That medical officer also said an investigation needs to be done, though, to determine the source of the lead. Haven't we all gotten to the point now where they figured out it's water and it's not paint chips or...
Well, again, the mayor reinforced the point of water, as did the doctor, and again, there's evidence from the CDC, I believe, that talks about the bathing water issue.
Yes. If I could also make a clarification, because I did want to follow up on what the mayor said earlier, because she's absolutely correct. I mean, well, the reason that we're here in this room right now is due to the water. And the water that we see is an associated elevated blood lead levels in children, particularly in 2 high-risk zip codes within Flint that were first detected by my colleague, Dr. Mona Hanatisha, and that we were able to subsequently confirm. So water is why we're here, and water is why we're responding. So please be aware of that. What I would just want, there's a nuance with the testing, that every test that we have that comes up elevated needs to have that investigation. And we have, and this is why it's so important when the governor mentions it, or when Director Lyon mentions this, we are having anecdotal stories of our case managers going into homes now, recently, within the last couple weeks, finding out that a child might have an elevated blood lead level and they still don't have a filter, or they may have a filter and it's not on appropriately. That means there's a lot of work to do, and I know Captain Kalinsky and I have talked about this thoroughly, and this is really number one, I know, on the operations response agenda. So that is a very important part of the case management. I just want to say that I can't tell you that all of, I think it was 43, are due to that, but the reason why we're doing all this is to the water, and thank you, Mayor, for emphasizing that. I appreciate it.
Governor, do you have a crisis in the public schools?
Kind of watch it coming up pretty soon. Will there be any further emergency appropriations for Flint or the schools or debts or anything like that?
Yeah, one of the things we're looking at, and we're going through a process of getting input from a number of parties, including the city and other experts, is potentially a supplemental appropriation request to precede the budget request.
You have a crisis in DPS with 60 schools closed today by teachers staging a sick out who say their working conditions and the condition of schools in Detroit aren't possible.
Well, again, that's a terrible thing to have happening there, and the real question is I appreciate people having different perspectives. To do it at the expense of the children, I don't believe is the best course of action. There's other venues for them to make their points and to review those. I'm happy to have our team go through an analysis along with the emergency manager. To have it at the expense of the children, I don't believe is appropriate.
We are almost out of time. Alicia from the press.
Did you personally sign off on the decision for Flint to start drawing water from the Flint River?
I didn't specifically go through that analysis, as I recall.
And Chad has one. Yeah, one more from Chad. I didn't remember.
You want to answer all the questions? Should you do that?
We have a protocol for taking questions.
Just to follow up on FEMA, what is the timeline for getting an emergency declaration request to the federal government?
Again, that's where we can't put a specific timeline on that yet, Chad, because we're early enough in the process. We'll be glad to provide more detail and time frame as we get into this and we get to the details.
Jim is going to wrap it up, and then we're done here.
Should you have paid more attention to this issue when it first started?
Well, obviously, in retrospect, there's always opportunities. You wish you could go back and do things. We have to deal with the circumstances we have today. This is something none of us wish would have happened. And the question is, how do we respond to the crisis in front of us? And I think we're trying to be very proactive in a partnership context to say, let's get near term, let's get issues resolved in terms of having filters, bottled water available. In the longer term, let's make sure we're doing the long-term health care plans to take care of children and other individuals with elevated blood lead levels. How do we also make sure that there's a long-term water system that works well? And then how do we get lessons learned and do things statewide to do better? So there's a long list of things that we're still going to learn out of this. This is not over today by any means. This is just hopefully understanding that we needed to elevate the dialogue and take it to the next level. Work had been done, but more work needs to be done with more urgency. And I want to see us make a positive contact with every household in Flint to say, let's make sure you have a filter, bottled water, or access to blood tests in the short term.
Thank you very much, Governor. Thank you very much, Mayor. And everyone who understands. Thank you.